Alright, good day people. I'm here to present this short lecture about temporal bone. The title is How to Read a Temporal Bone CT. This is a systematic axial approach. My name is Garcia-Pires. I am a visiting medical doctor here at LSU Shreveport. There is no conflict of interest on this presentation. This is not an original material. All the work here is copyrighted, but it's a fair use because it's for educational purposes. I'm crediting here the sources. Most of this lecture was taken from this professor. He is a very good professor. His name is Dr. Mamdou Mahfouz. I really recommend you guys to check his website. He has many resources to learn radiology, most of them in Arabic, but he also have some content in English, so check it out, guys. Besides, I'm using some content from StudyX, Visible Body, and these other sources listed here. So the temporal bone is a shy guy, and many people have problems with him. He's usually misunderstood, but he's only a shy guy. I guarantee that after this lecture, you're gonna be friends. So this is the temporal bone. This is a view from inside, the lateral and the axial view. It's here. And this bone is divided into 4 or 5 pieces. It depends on the source where you read. Some people separate the petroid and the mastoid part. Some people say that petromastoid is one part of the temporal bone. But what matters for us here when we read the temporal bone CT is the petromastoid and the tympanic part. Okay? This is the tympanic part. This is the petrous part from outside and from inside. And this is the internal acoustic meatus, or internal auditory canal. The ear is divided into 3 major parts: the external ear, the middle ear, and the inner ear. The sound waves comes from outside, reaches the eardrums or the tympanic membrane as you wish, made the ossicles to vibrate to send all this information to the inner ear. Okay? Here is another image showing the eardrum or tympanic membrane as you wish, the ossicles, and the muscle, the tensor tympani muscle. It arises from the Eustachian tube and attaches to the malleus in the intersection between the neck and the handle of the malleus. When we see the temporal bone on the CT, we're gonna see like that. This is the petrous apex, this is the inner ear, this is the middle ear that is connected to the mastoid cells, and this is external ear. When we see the middle ear on the coronal view, it's super important to divide the middle ear into these 3 components: the epitympanum, mesotympanum, and the hypotympanum. The epitympanum is from the scutum, that is here, until the tegmen tympani. Okay? The hypotympanum is from the tympanic annulus to the floor of the middle ear. Here you draw a line, and what it's in between is the mesotympanum, between the scutum and the tympanic annulus. Okay? So let's start from the easiest part. This is the external ear. It's super simple because the external ear has its cartilaginous and its osseous component. Okay? The limit is the tympanic membrane, or the eardrum, as you wish. And the anterior and superior part of the tympanic annulus is the scutum, that's here, that is best viewed in the coronal view, as we saw here. Okay? This is the middle ear. This is a view from outside, like when you're doing an otoscopy, and this is a view from inside. Okay? When you do the otoscopy, the tympanic membrane should be transparent. Okay? And it's like a drum, so the tympanic membrane is tensa, it's stretched. So most of the membrane tympanic is the pars tensa. The only part that it's not super stretched is here in the anterior superior part of the tympanic membrane, and this is called the pars flaccida, and this is where the cholesteatoma arises, so that's why it's important. Here you see the handle of the malleus attached to the tympanic membrane. Okay, this is the only ossicle attached to the tympanic membrane, is the handle of the malleus. Okay, this is anterior portion, posterior portion, superior and inferior. Here from the inside you see the eardrum, or the tympanic membrane, as you wish, and the handle of the malleus, it's attached to the tympanic membrane. Here you can see the tensor tympani muscle arising from the Eustachian tube, from its bony spike, and inserting in the malleus between the neck and the handle of the malleus. Okay? Here you can also see the smallest muscle of our body. This is the pedius muscle. It arises from the pyramid eminence and attaches to the neck of the stapes. Okay? The stapes is the smallest bone in our body. So let's gonna make a quick review about the ossicles. This is the malleus, this is the incus, this is the stapes. The stapes attaches to the oval window. This is easy to remember because the foot plate of the stapes looks oval. Okay? There is a mnemonic for that. I really hope that it helps you guys. It's called miso. Okay? Like the Japanese miso soup. So, remember, meso, malleus, incus, and stapes attaching to the oval window. There are two joints, super important, in the middle ear. It's important for you to know the names of these joints, because if you have a disruption and a dislocation, you must report which joint is affected. So, we have the incudo-malleolar joints, incus and malleus, incudo-malleolar joint. And we have the incudo-stapedial joint, incus, stapes, incudo-stapedial joint. Okay? Incudo-malleolar and incudo-stapedial joint. Let's gonna be more specific about the parts of the ossicles. The malleus have its head, its neck, and its handle. This is the incus, and the incus has its body, that it's right here, its short process, and its long process. Here is the lenticular process attaching to the stapes. Okay, so the incus has 4 parts. Now let's go to the stapes. The stapes has its head, its crura, the anterior and the posterior, and the end foot plate that attaches to the oval window. Okay, here you can see the stapes attaching to the oval window in the vestibule. Okay, the vestibule is part of the inner ear. We're gonna talk about it later. Let's make a quick review about the anatomy. Here we have amazing images to show. So here is the external ear. This is the eardrum or membrane or tympanic membrane, as you wish. Here you can see that the middle ear connects to the nasopharynx through the Eustachian tube. Okay? The Eustachian tube shows this muscle that we can see better here. This is a tensor tympani muscle, and it attaches to the malleus here in the intersection between the neck and the handle of the malleus. Okay? The ossicles are not floating in the middle ear. They are supported by some ligaments that we cannot see on the CT. And if some question asks you which nerve is in the middle ear, is this nerve here, is the chorda tympani. It's a small branch from the facial nerve. The facial nerve is here in the inner ear, and it has a small branch that goes to the middle ear. That is the chorda tympani. Okay, here you can see better the chorda tympani, the tensor tympani muscle attaching to the malleus. We're gonna talk about the inner ear afterwards. Here, a better view of the ossicles, handle of the malleus, neck, head. Remember, guys, that the malleus looks like a hammer and like a femur. So it has its handle, it has its neck, and it has its head. Okay? Here is the incus, incudomalleolar joint, body of the incus, short process of the incus, long process of the incus, lenticular process of the incus, attaching through this incudostapedial joint to the stapes. Here it's the head of the stapes and the crura. Okay, so this was a very quick review about the anatomy. Now, let's talk about what really matters for us, reading a CT. Okay? We're gonna be guided by the ossicles and by the middle ear. Okay, we're gonna read the epitympanum, the mesotympanum, and the hypotympanum. Okay, so when we are in an upper slice here, we don't see the ossicles, we just see air and the tegmen tympani. We're at this level here, the epitympanum. When we are in the mesotympanum, we always have to look for this ice cream cone. This ice cream cone is made of the head of the malleus, that it's right here, the body of the incus, that it's right here, and the short process of the incus, that it's right here. Okay? So this is the ice cream cone. If you go a little bit lower, sometimes you don't see this perfect image, but you gotta look for these two dots here. Okay? That is the handle of the malleus right here, anterior, and the long process of the incus right here, posterior. And you always have to look for the paws of this animal that looks like a sea lion. Okay, so the markers, the landmarks are the ice cream cone, the sea lion, and the two dots. Okay, this is the easiest part, the epitympanum. There's only air here. You gotta look for the tegmen tympani. Why? It's super important for you to look for the integrity of the epitympanum, because this is a wall that separates what it's in the middle ear and what it's in the intracranial space. So you always have to look if the tegmen tympani is intact in its anterior and in its superior portion. So we always look in the coronal and the axial view, how it is. Okay? Now this is the famous ice cream cone. I have a silly way to remember about that. It's the ice cream cone. You remember that the incus has its C, so it's easier to remember that the cone, it's in the incus. Sometimes you can lose a question because in the board they point towards a structure and you have to say what it is a structure. So okay, this is the head of the malleus. The ice cream itself is the head of the malleus, that it's right here, okay? The body of the incus and the short process of the incus, okay? The middle ear connects to the mastoid cells. This is a place called antrum, through this door that it's called additus ad antrum, okay? And of course we have this joint between the malleus and the incus that it's called incudo-malleolar joint, okay? So this is our first landmark. You always have to look for this ice cream cone. If you don't find this ice cream cone, it's probably because there is some dislocation between these two ossicles. So pay attention to that. If you go a little bit lower, you're gonna see these two landmarks. The first landmark is the two dots landmark. Let's remember that the malleus is anterior and the incus is posterior. So when you are here reading the CT, this is the anterior part, this is the posterior part. The first dot is what? Is the handle of the malleus, okay? The first dot is the handle of the malleus. The second dot, the posterior dot, is the long process of the incus. And how we're gonna see the stapes? It's easy. You just have to follow down the incus, because you're gonna see where it attaches to the stapes in the cutostapedial joint, okay? And if you follow the stapes, you're gonna see the stapes attaching to the oval window, but the oval window is better seen on the coronal view. So let's jump to the coronal view. This is the coronal view, where you can see here the oval window. You see, this is the incus, the long process of the incus attaching to the head of the stapes. These are the crura of the stapes, anterior and posterior, and this is the end foot plate of the stapes attaching to the oval window. You cannot see well the oval window here, but you can see here on the coronal view. Okay, so we're talking about the coronal view, right? Just remember that this is the end foot plate of the stapes attaching to the oval window in the vestibule, okay? This is an axial approach, as I said before, but the coronal view is important for us to see basically four things. The first thing is the scutum, and the scutum is going to be your landmark on the coronal view. Everybody knows the scutum because this is where usually the cholesteatoma arises, so we always have to look for the scutum, okay? When you are in the level of the scutum, you can see the oval window here, the oval window here. You can see the facial nerve under the semicircular canal and the tegmen tympani, okay? These are the four important structures you have to look for when you are analyzing this coronal view. So let's go back to the axial view, because this is our approach. Here you see the sea lion here. It's always important for you to look for its paws. Sometimes you cannot see this perfect image here, but you always have to look for its paws, because its paws are always perfectly viewed. Okay. Let's make it bigger. I think that its head looks like a crocodile instead. So, as you wish, you can use it like a sea lion landmark or this bizarre animal here. What it's important when you are looking here for its paws, it's important for you to look for this eminence here, that it's called pyramidal eminence. And this is important because it's where the stapedial muscle arises, okay? When you look for the medial part, for this recess here, you are seeing the sinus tympani. This is important because sometimes this is where the cholesteatoma remains, and it changes the ENT management for the patient. It changes how the ENT is going to operate this middle ear, if it affects or if it doesn't affect the sinus tympani. So we always have to report that. This is the facial recess, and this is where the facial nerve passes on its way to the stylomastoid foramen. Okay? Here in the face of this animal, you see the eustachian tube, and from the eustachian tube you have a bony spike, and it's where the tensor tympani muscle arises. You can see here a little bit of the tensor tympani muscle. Here you can see better the eustachian tube and the tensor tympani muscle arising from the eustachian tube and inserting into the malleus between its neck and its handle. Okay, so let's make a big review about what we've learned so far. This lecture is about repetition, guys, so I'm gonna repeat 1,000,000 times, and I guarantee that at the end of this lecture you're gonna be able to remember all the structures of the ear, okay? So let's make a quick review. This is the ice cream cone. So this is the head of the malleus, the body of the incus, the short process of the incus. The middle ear connects to the mastoid cells through this door that it's called adductus ad antrum, and this is the antrum itself. If you go a little bit lower, you're going to see these two dots. The first dot is the handle of the malleus, and the second dot is the long process of the incus. If you follow the incus down, you're gonna see the incus attaching to the stapes, okay? This is where you also see this animal here, that it's the sea lion. You always have to look for its paws. This is the eminence that it's important for you to remember, because this is the pyramidal eminence. It looks like a pyramid, right? In the medial portion, this is called sinus tympani. The lateral portion is the facial recess, where the facial nerve passes on its way to the stylomastoid foramina. So let's jump to the inner ear. We have these structures here: the cochlea, the semicircular canals, the facial nerve, the internal auditory canal, the cochlear aqueduct, and the vestibular aqueduct. I'm going to show you better images later. So, as we have landmarks for the middle ear, we also have landmarks for the inner ear. And what you basically have to remember is guide yourself from the lateral semicircular canal. This is going to be your star for you to guide yourself in the night, okay? This is the lateral semicircular canal. Remember that all the semicircular canals ends in the vestibule. So this is the vestibule, this is the lateral semicircular canal, that it's right here, okay? Always remember that the cochlea is anterior comparing to the semicircular canals. And the semicircular canal says it's lateral, it's posterior, and it's anterior or superior semicircular canal. This is the vestibule. Here we have the oval window, and here connecting to the cochlea we have the round window, okay, that it's a niche of air. Let's make again a quick review of this anatomy. This is the cochlea. These are the semicircular canals. They are connected through this vestibule. Always remember that the cochlea is anterior, inferior, and medial comparing to the semicircular canals, okay? Always remember that the facial nerve passes through the inner ear, as you can see here, and on its way it passes under the lateral semicircular canal, as you can see here. Okay? Always remember that the facial nerve has one branch that passes in the middle ear. This is the branch, and this is called chorda tympani. Sometimes they can ask you on the boards, which is the nerve that passes in the middle ear? It's the chorda tympani, a branch from the facial nerve. Okay? The cochlea has two turns in half. You can see here the basal turn of the cochlea. It's one and a half turns, and its cupula or dome, as you wish. Okay. Here you can see perfectly the nerves that passes through the internal auditory canal. This is the facial nerve. This is the cochlear nerve, and this is the vestibular nerve that has its superior and inferior portion. Always remember that the vestibular cochlear nerve is thicker than the facial nerve because there are two nerves into this one component, okay? The vestibular and the cochlear nerve, so it's thicker and it's posterior in relation to the facial nerve. Okay, this is also the inner ear. Here you can see the round window, and here you can see the steps from the middle ear attaching to the oval window in the vestibule. Here a little bit bigger, the vestibule. Okay. So this is our landmark, the lateral semicircular canal. Usually you have the lateral semicircular canal in the same slice where you see the ice cream cone. It's not in every single study that you read, but usually is in the same slice. Okay? Here you start to see the posterior semicircular canal and the lateral semicircular canal. Again, the lateral semicircular canal ending on the vestibule, and these are the posterior semicircular canal. This is the internal auditory canal. And here is the facial nerve on its ascending part. This is the geniculate body, and this is the descending part. The ascending part is also called the labyrinthine part, the geniculate body, and the descending part that points towards the middle ear, it's called tympanic part. Okay, ascending or labyrinthine, geniculate body, and descending or tympanic branch. Okay, so let's make again a quick review. We can see here the middle ear cavity, the head of the malleus, the body of the incus, the short process of the incus, the middle ear connecting to the mastoid cells through this door that it's called adductus ad antrum, and this is the antrum itself. Here the structures of the inner ear, that what we are learning here. It's a lateral semicircular canal, and in the vestibule, here you see part of the posterior semicircular canal, here part of the internal auditory canal, here the facial nerve, the ascending part, the geniculate body, and the descending part. Here you start to see the cochlea. Here is where the cochlear nerve enters the cochlea on its way from the internal auditory canal to the cochlea. Okay? Here, the internal portion of the cochlea, it's called modulus. It's like a stair. Okay? Again, lateral semicircular canal, vestibule, and part of the posterior semicircular canal. If you want to see the superior semicircular canal, you just have to go a little bit upper, okay? Here, the only thing you're going to see is the superior semicircular canal, that it's like that, okay? You always have to look for its integrity, because its walls have to be intact. It's not so unusual to see dehiscence of this wall of the superior semicircular canal, so you always have to look for its integrity on the axial and on the coronal plane, okay, like here. So again, the cochlea, it's basically in the same level the lateral semicircular canal. That's because we use the lateral semicircular canal like our guide star. And this is the cochlea. These are the 3 cuts showing the entire cochlea. If you go to this lower portion of the cochlea here, this is the basal turn of the cochlea, and it ends in this dot of air that it's called the round window. We can see that here, this is the basal turn of the cochlea ending in this dot of air that it's the round window. If you go a little bit more up than what you are, you can see the 1.5 third of the cochlea, okay? And if you go a little bit more up, you're gonna see the cupola or dome of the cochlea, okay? The cochlea has always 2 turns and half. This is important because if you don't have the 2 turns and half, you don't have a normal anatomy. You have to report that, okay? These are other structures that it's super important. We have these 2 aqueducts. One of them looks like the internal auditory canal, but it's a little bit inferior to the internal auditory canal. This is called the cochlear aqueduct. It points towards the cochlea, as you can see here. So this is the cochlear aqueduct. It's like a mini internal auditory canal, but it is inferior to the real internal auditory canal. And if you go, if you see here, you can start to see the vestibular aqueduct, but it's not so good to see here. I'm gonna show you better images later, okay? So again, this is the basal turn of the cochlea, and on its tip, you can see this dot of air that it's the round window, okay? Again, the cochlear aqueduct, you can see pointing towards the cochlea like a mini internal auditory canal, but inferior to the real internal auditory canal. This hair-thin shape structure that is the cochlear aqueduct. And posterior, you can see this hair-thin structure that is called the vestibular aqueduct. How do I know if this is normal or this is not normal? The vestibular aqueduct shouldn't be bigger than the posterior semicircular canal. The vestibular aqueduct is always posterior to the posterior semicircular canal, and you use the posterior semicircular canal as a reference for you to know if the vestibular aqueduct is enlarged or is normal. Here you have an enlarged vestibular aqueduct comparing to the posterior semicircular canal, okay? This is a cause of sensorineural hearing loss, so if you see this abnormality, you have to report. Just saying here, the maximum diameter of the vestibular aqueduct should be 1.5 millimeters, okay? But we don't usually measure that. We always compare to the posterior semicircular canal. Okay, another structure that it's really near to all these structures that we said before is the jugular bulb. Okay, the jugular bulb should have this bony wall separating the jugular vessel from the external auditory canal. When you don't have a bony wall separating, you are in a situation called dehiscent jugular bulb, and you always have to report that because it's dangerous. If somebody makes an otoscopy here, see this abnormality and decide to biopsy this structure, can you imagine how big would be this thing? So if you see this dehiscent jugular bulb, report that. Okay, so let's jump to the facial anatomy nerve, to the facial nerve anatomy. Here's a 360 3D images. It's very good. You'll see the facial nerve arising from the brainstem, going to the internal auditory canal. Okay. Now you'll see the facial nerve entering the inner ear, passing above the cochlea, giving its ascending portion, the geniculate body, and going to its descending portion, pointing towards the stylomastoid foramina. On its way to the stylomastoid foramen, it passes under the lateral semicircular canal. Okay. Now, passed already the stylomastoid foramen, passes through the parotid gland and gives its branches to the face. So, how can I recognize the facial nerve anatomy when I'm reading a CT scan? It's not difficult, guys. It's really easy. You just have to guide yourself through the internal auditory canal. Remember that the facial nerve arises from the brainstem posteriorly, goes to the internal carotid, to the internal auditory canal with the vestibulocochlear nerve. Here you can see the facial nerve given its ascending portion or labyrinthine portion, now the geniculate body, and then the descending or the tympanic portion. This is the lateral semicircular canal. The facial nerve would pass under this structure here, okay? But we're gonna see better on the coronal view. So the facial nerve has its four segments. It's the intraaxial segment, the external segment emerging from the brainstem and entering the internal auditory canal together with the vestibular cochlear nerve. It has the intratemporal segment where it passes in the inner ear and has its ascending or labyrinthine portion, the geniculate body or geniculate ganglion, its descending portion or tympanic portion that passes under the lateral semicircular canal, pointing towards the mastoid where it's going to pass through the stylomastoid foramen. Okay, again we can see the internal auditory canal, the ascending portion or labyrinthine portion of the facial nerve, the geniculate body, and the descending or tympanic portion of the facial nerve. Here you see that after giving its descending branch, this facial nerve passes under the lateral semicircular canal, pointing towards the stylomastoid foramen. Again, the facial nerve passing under the lateral semicircular canal. Again, the facial nerve passing under the semicircular canal and going to the stylomastoid foramen. If somebody asks you which is the vessel that is usually at the CP angle, you're going to answer that is the AICA, the anterior inferior cellular artery. Sometimes they ask you that. I know that this lecture is about the temporal bone CT, but I'd like to tell you that The bony part of the inner ear, it's like a mold. It's like a bony mold, a bony hard shell that protects what's inside this structure that it's called the membranous labyrinth. Okay? And the membranous labyrinth you're gonna see only in the MRI, that it's good to see soft tissue. Okay? It's like exactly like the bony portion, but this is where the structures, the real structures, are working together to make we listen to things. Okay? They love to ask this question here. So there is a mnemonic that it's the 7-Up, Coke down. Don't drink Coke, guys. A lot of sugar. So 7-Up, Coke down. You always remember that when you enter the cafeteria, the soda pops are always there in front of you. So this is anterior, guys. Anterior portion of the internal auditory canal. You're gonna see 7-Up, Coke down. And in the back, hidden, you're gonna see the vestibular nerves, superior and inferior portions. Okay? Here you can see the facial nerve, 7-Up, the cochlear nerve, Coke down, and the vestibular nerves, okay, on its posterior part. Okay, so let's gonna make a quick review of what we learned so far. This is the ice cream cone. The ice cream itself is the head of the malleus. This is the incudo-malleolar joint, the body of the incus, the short process of the incus, the Prusac space. This is the lateral semicircular canal ending in the vestibule. This is part of the posterior semicircular canal. The medial ear connects to the mastoid cells through the adductus audantrum, that it's not so good to see on this slice here. Okay, a little bit down, you can see the internal auditory canal, the ascending portion of the facial nerve, or its labyrinthine segment as you wish, the geniculate ganglion, and here the descending portion, or the posterior genicle as you wish, or tympanic segment of the facial nerve. I don't know why they have so many names for the same structure, but I usually use ascending and descending portion. Okay? This is the descending portion, or the tympanic segment of the facial nerve, that continues down here on its way to the stylomastoid foramen. Okay? On this way, here is where the facial nerve is passing under the lateral semicircular canal, as you can see here. Okay? The lateral semicircular canal and the facial nerve here. Okay, we also have these two dot signs. This is the handle of the malleus. This is the long process of the incus. Here you have the incus attaching to the head of the stapes. Here you have the anterior crural of the stapes, the posterior crural of the stapes, and the end foot plate attaching to the oval window. Okay? Here you see the cochlea. The cochlear nerve entering the cochlea, the 1.5 turns of the cochlea. And here the external ear. Here is the tympanic membrane, or the eardrums, and here is the handle of the malleus. How do I know that? Because the only structure that it's attached to the tympanic membrane is the malleus. And it is the handle of the malleus, the structure attached to the tympanic membrane. Okay? I know that we have this axial approach, but I should talk about this coronal view, guys. Here we have the scutum. If we go posterior, we're gonna see this oval window, the lateral semicircular canal, the tympanic membrane. Here we can see the tegmen tympani. Okay. of a window, scutum, and under the lateral semicircular canal, the facial nerve passing. Okay, guys? Okay, so ask yourself, do you know how to name all the structures? If you don't know, go back and try to see what's that, and then answer yourself. Another one. Another one. Another one. Another one. Another one. I'm gonna give you the answers, guys. So this is the anterior or superior semicircular canal, this is the lateral semicircular canal, and this is the posterior semicircular canal. Here is the internal auditory canal, and this is the vestibule. Here we have the cochlea. Here we have the superior semicircular canal, and here the cochlea. Here the stylomastoid foramen. And this is basically for you to remember that is the Eustachian tube. And this is a bony spike, and this is where the tensor tympani muscle arises. Then you always have to look for this pause, the pyramid eminence, the sinus tympani, and the facial recess. Okay, head of the malleus, body of the incus, short process of the incus, lateral semicircular canal, vestibule, portion of the posterior semicircular canal, internal auditory canal, facial nerve, ascending part, geniculate body, descending portion of the facial nerve. Thank you very much, guys. I really appreciate the time I spent here with you. It was a pleasure for me to be here learning from all of you. I'd like to really thank each one of you for the experience you gave me the chance to have, and it was amazing being here with you. I'm gonna miss it so much. So before we finish, I'd like to make this interaction with you, like reading a temporal bone. And here is the interactive temporal bone atlas that the University of Washington made. So let's go there. This is the axial view. Let's point. Here you start to see the superior semicircular canal. Okay, superior semicircular canal, superior semicircular canal. Now here you start to see the cochlear aqueduct, like this mini internal auditory canal. Going a little bit under, you see the vestibule and the lateral semicircular canal and parts of the posterior semicircular canal. Here, this portion in the posterior part is the vestibular aqueduct. You see the cochlea, the modulo inside the cochlea, the posterior semicircular canal, the basal turn of the cochlea, the niche of air of the round window in the base of the basal turn of the cochlea, better seen here. And this is the cochlear aqueduct, guys. I'm sorry about that, because I told you that it was here. I was wrong. This is here. Okay? This is the cochlear aqueduct. I'm sorry about that. This is the jugular bulb, making its wall, separating the external auditory canal from the jugular fossa. Okay, let's talk about the middle ear now. Here, the ice cream cone, head of the malleus, body of the incus, short process of the incus, going down, down, down. Let's follow the incus, guys. Follow the incus. The two dot signs. Anterior is the handle of the malleus, posterior, the long process of the incus, and on its tip is the lenticular process of the incus. See, it is attaching to the head of the stapes. You can see that the stapes is really small, but you can see the anterior and the posterior crura attaching to the oval window, right there. Okay. Always remember that the middle ear connects to the mastoid cells through this door, that's the adytus adantrum, and the mastoid cells, this big portion of air, is the antrum itself. Okay, going down, down, down. Nothing important anymore. And the external ear that has its cartilaginous and these bony parts. That's it, guys. Super easy. It's super easy. Let's see on the coronal view. You're gonna see that you are able to recognize even in the coronal view, despite we don't talk about that. So this is posterior, this is anterior. Always remember that the cochlea is anterior, medial, and inferior, comparing to the semicircular canal. Here you see the basal turn of the cochlea, the 1.5 turns, and the dome or cupula. Okay? Here you see the semicircular canals, the vestibule, all of the semicircular canals ends in the vestibule. So this one in the center is the vestibule, the lateral semicircular canal, the superior semicircular canal, and the posterior semicircular canal here. Okay? Here you see the internal auditory canal, giving its ascending portion of the facial nerve, geniculate body, descending portion of the facial nerve, passing under the lateral semicircular canal. Very easy, guys. Very easy. Now let's see the middle ear. Here you see the tympanic membrane. What's attached to the tympanic membrane is the handle of the malleus. So that's it. The handle of the malleus. This is the neck and the head of the malleus attaching to the incus. So this is the incus. This is the long process of the incus attaching to the stapes. And the stapes is attached to the oval window. Very easy, right, guys? Very easy. And the external ear, the cartilaginous and the bony parts. See how easy is this thing? Don't be afraid of the temporal bone anymore, guys. This is easy. This is really easy. You just have to practice. I know that now you and the temporal bone are friends. So keep on being friends. When you have time, just make a quick review in this class, in this lecture. Open a temporal bone CT, look for the structures. I know that if you see this like each 15 days, you're gonna be friends forever, you and the temporal bone. Okay? Thank you very much. Remember that united we are better. Better together. We are better together. Thank you very much. Bye bye.